All right, so today we're going deep on something that most of us hopefully never have to deal with, brain abscesses.
Yeah.
And, you submitted some research on this, so it's clearly on your mind.
Right, huh?
We're here to kind of help you figure out why this information is important to you. So, in the simplest terms, a brain abscess is basically an infection that creates a pocket of pus in the brain. Not exactly a party you want going on up there.
Yeah, it's not a good housewarming gift.
Yeah.
Most of us don't encounter this often, but
Right.
understanding how these infections even get into the brain in the first place is really fascinating. Yeah, it's kind of like a medical detective story.
Ah, I love a good mystery. So how do these infections even, get past the brain's defenses? Seems like a pretty well-protected organ.
It is very well protected. You're right, but there's a couple of ways that infections can get in there.
Okay.
One way is what we call contiguous spread. So think of it like a neighbor just dropping by uninvited. The infection spreads directly from nearby areas like your sinuses or your teeth or your ears.
Yeah. Oh, okay.
So if you've ever had like a really bad sinus infection that wouldn't go away, you could imagine how that could become a bigger problem.
Right. Okay, so that makes sense. But what about infections that aren't right next door? Like, how do those reach the brain?
That's where hematogenous spread comes in.
Okay.
This is when the infection takes a longer route, travels through the bloodstream from somewhere else in your body.
Oh, okay.
It could be a distant infection,
Yeah.
maybe a skin infection, or even pneumonia. That sends out, little bacterial scouts, so to speak, and they eventually end up in the brain.
So it's like those little travel bugs people hide, but not so fun.
Yeah, not so fun.
And I'm guessing this point of origin is really important for doctors to figure out, what is actually causing the brain abscess?
Absolutely, yeah. The location of the abscess in the brain can actually give us clues about where that original infection might have started. For example, an abscess in the frontal lobe, that's the part of your brain kind of behind your forehead, might suggest, a sinus or a dental infection,
Right.
whereas an abscess in the temporal lobe that's closer to your ears
Right.
could point to an ear infection.
Interesting.
So it's all about connecting the dots.
So it really is detective work. Now, I'm dying to know, who are the usual suspects behind these brain abscesses? Are we talking about, common bacteria that we hear about all the time?
Yeah, you bet. The most
Yes.
common culprit is a type of bacteria called streptococcus, and specifically the viridans streptococcus species. Think about all the times you've had a sore throat.
Sure.
That's often caused by streptococcus just hanging out in your mouth and throat.
Right.
So you could see how, under the right circumstances, it could cause trouble if it gets into the brain.
Yeah, makes total sense. And I remember from the research that you shared that some recent data from the UK was highlighting a specific group of streptococcus, the strep anginosus group. They were saying that it's particularly prevalent in brain abscesses. And didn't you say that anaerobes also play a big role? Those are the bacteria that don't like oxygen, right?
Yeah, you've got a great memory.
Well, I try.
Anaerobes are frequently involved as well. Bacteria like bacteroids, fusobacterium, and even some types of anaerobic streptococci. These guys actually thrive in low oxygen environments. And those can sometimes be found within an abscess.
Right. So if doctors find those bacteria in a brain abscess, it might not tell them exactly where it came from,
Okay.
but it helps narrow down the possibilities, like another clue.
Exactly. It's another clue in the mystery. But, it's not just those usual suspects.
Okay.
We've also got Staphylococcus aureus,
Right.
especially the methicillin-resistant kind, known as MRSA,
Yeah.
which could be a real problem. And then there's the Enterobacterales family.
Okay.
That includes, a bunch of different bacteria that are commonly found in the gut. And let's not forget Pseudomonas aeruginosa.
Right.
It's a bacteria often linked to infections after surgery. It's quite a diverse cast of characters.
It is, yeah. It's a lot to keep track of, but I'm starting to understand how, identifying that specific bacteria is really crucial in, piecing together where the infection came from, right? Each bacteria has its own little fingerprint.
Yeah.
So you mentioned Pseudomonas aeruginosa being linked to surgery. Are there other bacteria that tend to show up based on, certain risk factors?
Absolutely.
Yeah.
For instance, you've got Cedosporium, which can be found in water and soil. It's often linked to brain abscesses in drowning victims.
Oh, wow.
And Nocardia, another bacteria found in the environment, is more common in people with weakened immune systems, like people with HIV.
So it's not just what type of bacteria it is, but also, the person's history and circumstances, right? It makes it even more like detective work.
Absolutely.
But hold on, before we get too carried away with bacteria, are they the only DRI culprits behind brain abscesses? What about, fungi or parasites?
You're right to bring those up. Bacteria are the most frequent offenders, But fungi, like Candida, which can cause yeast infections, can also lead to brain abscesses. And we can't forget about parasites, particularly Toxoplasma gondii.
Okay.
This parasite is often linked to cat feces, but you can also get it from eating undercooked meat.
Wait, so something as simple as like cleaning a litter box or having a rare steak could lead to a brain abscess? That's both fascinating and a little terrifying.
It is, yeah.
Are there any other, like, parasites we should be aware of?
Well, there's one that's both fascinating and kind of creepy. It's a tapeworm called Tinea solium.
Okay.
And the larval stage of this tapeworm can cause something called cysticercosis.
Yeah.
If someone eats undercooked pork contaminated with these larvae, they can actually migrate to the brain and form cysts.
Wow.
And if those cysts get infected, you guessed it, brain abscess.
Now we're getting into some seriously adventurous territory. So, eating undercooked pork in certain parts of the world could be a risk factor.
Yeah.
Noted. I'll keep that in mind.
It's a good reminder that our health is, interconnected with our environment and our choices. And this brings us back to that detective work we were talking about. Understanding a patient's background, their travel history, their dietary habits, all of that can provide valuable clues.
It's all starting to make sense now.
Good.
But let's shift gears for a second and talk about what this would actually feel like for someone who's, experiencing a brain abscess. What are the signs that they should be looking out for?
That's a great question. And it's important to remember that the symptoms can vary a lot depending on where the abscess is, how big it is. However, there's kind of a classic triad of symptoms that doctors often look for.
A triad, like a secret society of symptoms.
Not quite a secret society, but close. The triad consists of headaches, fever, and what we call focal neurological deficits.
Okay.
Basically, these are problems with specific functions controlled by the affected part of the brain.
So, like, if someone suddenly has trouble speaking or weakness in one arm, and they also have, like, a fever and a pounding headache, that could be a sign.
It's certainly a possibility, although those symptoms can also be caused by other conditions.
Yeah.
Other symptoms like seizures, a stiff neck, vomiting can also occur, particularly if the abscess is causing increased pressure inside the skull.
So this raises an important question then. Are these symptoms unique to brain abscesses? Or could they be signs of something else entirely?
Right.
Like if I have a headache and a fever, should I immediately assume the worst?
No, not at all. That's the tricky part. These symptoms can actually mimic a lot of other conditions.
Right.
From the flu to migraines to even meningitis. That's why it's so crucial to seek medical attention.
Yeah.
If you experience any of these symptoms, especially if they're severe or persistent.
Right. So it's not just the symptoms themselves, but also the context and, like, the individual's medical history and any other risk factors they might have.
Exactly.
It sounds like diagnosing a brain abscess is a real team effort.
Absolutely.
Requires, like, looking at all the clues. Speaking of tools, what role does imaging play in diagnosing a brain abscess?
Oh, imaging is essential. An MRI of the brain is really considered the gold standard because it provides like the clearest picture of the abscess.
Yeah.
We can actually see the abscess on the MRI scan.
Yeah.
Its size, its location, even some characteristics of the surrounding brain tissue. However, a CT scan with contrast can also be helpful, especially if an MRI isn't readily available.
I see. And what about lumbar punctures, also known as spinal taps? Are those used to diagnose brain abscesses?
That's a good question. However, a lumbar puncture is actually not recommended in cases of suspected brain abscess. It's what we call contraindicated.
Okay.
If there's increased pressure inside the skull because of the abscess, doing a lumbar puncture could potentially worsen the situation.
Oh.
It's like poking a hole in a balloon that's already overinflated.
Right. Yeah, that makes sense. So if a lumbar puncture is off the table, what other tests are used to confirm the diagnosis and, really figure out what's causing the infection?
Blood cultures are crucial.
Okay.
They can sometimes identify the bacteria or other microorganisms that are responsible for the abscess.
Okay.
And if we suspect that the infection has spread from a nearby area, we might also take cultures from potential sources, like the sinuses or teeth or ears.
Oh, okay.
It's like following a trail of breadcrumbs back to the source of the infection.
So if the abscess is in the frontal lobe, close to the sinuses, you might, swab the sinuses to see if you can find the same bacteria.
Exactly. And depending on what we suspect is causing the infection, doctors might order additional tests like serology or PCR tests. For instance, if there's a possibility of toxoplasma infection,
Right.
we'd order specific tests to look for evidence of that parasite in the blood.
And I remember reading that testing for HIV is also important in these cases.
Right.
given that it can weaken the immune system and increase the risk of certain infections.
Absolutely. Testing for HIV is a standard part of the workup for any brain abscess. It helps us get a complete picture of the patient's overall health and immune status.
Okay. So we've covered how these infections develop, the different culprits involved,
Right.
the importance of a thorough investigation to diagnose them. Now let's move on to the good stuff, treatment.
Yeah.
I'm sure our listener is eager to know what can be done to actually fight these infections.
You're right. Let's dive into the treatment options. The first and most important step is to start antibiotics.
Okay.
As soon as possible, even before we have the results of the cultures back. This is what we call empirical antibiotic therapy.
So it's kind of like a calculated guess, but one that could potentially be life-saving.
Exactly. We base our initial antibiotic choices on the patient's symptoms, their medical history, any clues from imaging, and just our knowledge of the most likely culprits in a given situation.
So you're not just like throwing antibiotics at the problem. There's an actual strategy involved.
Absolutely. It's not random. In most cases, the initial antibiotic regimen will include a combination of ceftriaxone, metronidazole, and vancomycin.
Okay.
This covers a really broad spectrum of bacteria that are commonly involved.
And what if someone is allergic to penicillin, or if there's a concern for a Pseudomonas infection, which I remember you said can be tricky?
Excellent questions. If someone has a penicillin allergy, we have alternative antibiotics like ciprofloxacin, metronidazole, and vancomycin.
Okay.
And if we suspect Pseudomonas, the go-to combination is ceftazidimine, metronidazole, and vancomycin, or sometimes meropenem and vancomycin.
So even within the realm of empirical antibiotics, there's a lot of tailoring that's done based on the individual case.
Exactly. It's not one size fits all.
Right.
And it's not just about bacteria either.
Right.
If the infection is caused by a fungus, we might use antifungal medications like liposomal amphotericin B, fluconazole, or caspofungin. And for parasites like toxoplasma, we'd use specific antiparasitic drugs. The key is to identify the culprit and use the right weapon.
So it sounds like it's like a constant process of refining the treatment strategy as more information becomes available.
Yeah.
Now, what about surgery? When does that come into play?
Surgery is often necessary to remove the abscess itself.
Okay.
This can be done through aspiration, which involves using a needle to draw out the pus, or through surgical evacuation, where we actually open up a skull and remove the abscess directly.
So it sounds like surgery is a pretty common part of brain abscess treatment.
Not always.
Okay.
There are situations where surgery might not be the best option.
Yeah.
For example, if the abscess is small, less than 2.5 centimeters in diameter,
Okay.
and the patient is doing well neurologically, meaning their brain function is good, and we know what's causing the abscess, we might actually opt for a watch and wait approach. We'll monitor the patient really closely, continue the antibiotic treatment, but hold off on surgery unless things take a turn.
So smaller abscesses that aren't causing any major problems might be managed with just medication.
Exactly. Surgery might also not be the best choice if there are multiple abscesses scattered throughout the brain,
Oh, wow.
or if the abscess developed after surgery, or if the patient's at really high risk for complications from surgery.
Right.
In those cases, the risks of surgery might outweigh the benefits.
It's a delicate balance, weighing the pros and cons of each treatment option.
Yeah.
But before we wrap up this part of our deep dive, let's talk about something that can sometimes be a real head scratcher: differential diagnoses. So, are there other conditions that can mimic the symptoms of a brain abscess? And how do you rule those out?
That's a crucial point. There are actually several other conditions that can present with symptoms that look a lot like a brain abscess. So it's really important to consider these possibilities, rule them out to get an accurate diagnosis. We don't want to be treating the wrong problem.
Right. So what are some of the other, contenders in this diagnostic puzzle?
Some of the most common ones include CNS lymphoma, which is a type of cancer that affects the brain and spinal cord, CNS metastasis, which is when cancer spreads from another part of the body to the brain.
Oh, wow.
And even stroke, which happens when the blood flow to a part of the brain is interrupted. Each of these conditions can cause neurological symptoms similar to those seen in a brain abscess, so it's really important to distinguish between them.
So it's not always a clear-cut case.
Right.
It takes, careful detective work to arrive at the right diagnosis.
Precisely. That's why it's so important to have a skilled medical team involved, using their clinical judgment, imaging studies, and other tests to put all the pieces together.
Well, this has been an incredible deep dive so far. We've covered so much. We started by talking about what a brain abscess is. We talked about the different ways these infections can get into the brain.
Yeah. We've talked about all the different culprits involved, the diagnostic challenges, and the first steps in treatment.
It's a lot to take in.
We'll be back in a moment to explore the future of brain abscess diagnosis and treatment. But for now, let's take a short break.
Sounds good.
We'll be right back.
And we're back. So before the break, we were just talking about how complex it can be to diagnose and treat brain abscesses. But I'm curious, what about the future? What advancements could really, revolutionize how we approach this condition?
Yeah, that's what I was thinking about, too.
It really gets you thinking.
It does. Yeah, it's amazing to think about the possibilities. We've come so far in medicine, but, there's always room for improvement. What kind of advancements are you most excited about?
Well, imagine if we had a blood test that could tell us exactly which bacteria or fungus was causing a brain abscess, with pinpoint accuracy.
Oh, wow.
No more waiting for cultures to grow. We could just start targeted treatment right away.
Yeah.
Give patients the best possible chance of a good outcome. That would be amazing. Yeah. It's like having a magic wand that tells you exactly what the problem is.
Yeah.
No more guessing with antibiotics.
Exactly. And it doesn't stop there.
Yeah.
What if we had imaging technology that could not only show us the abscess, in super detail, but also, analyze its contents in real time?
Oh, wow.
We could get information about the specific pathogen,
Yeah.
How aggressive the infection is, how likely it is to respond to different treatments, all of that.
Wow, that sounds like something straight out of a sci-fi movie.
I know.
But it's not completely out of reach, right? We're seeing such progress in fields like AI and machine learning. It's easy to imagine those technologies being applied to medical imaging and just completely changing the game.
You're absolutely right. And let's not forget about personalized medicine.
Right.
Imagine a future
Right.
where we can use genetic testing to figure out who might be at higher risk for developing brain abscesses,
Yeah.
or to predict how someone might respond to different treatments.
That's a really fascinating thought. You often hear about personalized medicine and cancer treatment, but it makes total sense that it could play a huge role in infectious diseases, too.
Right.
If we could identify people who are genetically predisposed to certain infections or who are likely to, have a bad reaction to certain antibiotics, we could tailor their care so much better, maybe even avoid some serious complications.
Precisely. It's all about moving towards a more proactive, personalized approach to healthcare. I think that's really where the excitement lies. We're kind of on the verge of a new era in medicine. We can use cutting-edge technology and a deeper understanding of human biology to transform how we diagnose and treat, even prevent, diseases like brain abscesses.
It's an exciting time to be alive, especially if you're someone who's just fascinated by the world of medicine.
Yeah, absolutely.
But before we get too carried away with the future, let's take a moment to kind of recap the key points we've covered so far. We started by, defining what a brain abscess is, that collection of pus within the brain tissue caused by an infection.
Right. And we talked about the two main ways those infections can actually make their way into the brain. Contiguous spread, where the infection travels from a nearby structure, and hematogenous spread, where it travels through the bloodstream.
Right. And then we talked about all the different suspects involved.
Right.
From the usual suspects like streptococcus and staphylococcus to the less common culprits like fungi, parasites, and even tapeworms.
It's a motley crew.
Yeah, it is. And, we emphasize how important it is to consider the patient's medical history, travel history, even their lifestyle when you're trying to figure out where the infection came from.
Right. It's like detective work.
It really is. It's putting together a puzzle.
It is. Each piece of information is a clue that helps you kind of see the bigger picture. And speaking of clues, we talked about that classic triad of symptoms: headaches, fever, and focal neurological deficits.
Yeah.
But we also made it clear that, those symptoms aren't always present. And even if they are, they could point to a lot of different things, not just a brain abscess.
Right, exactly. So it's always best to just go see your doctor and get checked out, right?
Absolutely. Better safe than sorry.
Yeah. And we also kind of went through that diagnostic process, highlighted the importance of imaging like MRI and CT scans, as well as blood cultures and other tests that can help really identify that specific pathogen.
Right. And we talked about that initial treatment approach, starting with those broad-spectrum antibiotics to cover all the bases while you're waiting for those culture results.
Right.
And we emphasized that Antibiotic therapy really needs to be tailored to the individual patient and the suspected pathogen.
Yeah.
Taking into account things like allergies and the possibility of resistant organisms.
Yep. And we even touched on the role of surgery, explaining that it's not always necessary, but it can be a really crucial part of treatment in some cases.
Yeah, for sure.
We even took a little detour into the world of differential diagnoses, looking at those other conditions that can mimic the symptoms of a brain abscess, and highlighting just how complex that diagnostic process can be.
Absolutely. And then we wrapped up with some, blue sky thinking about the incredible advancements that could transform how we approach brain abscesses in the future.
It's been quite a journey. We've covered a lot of ground in this deep dive, but hopefully you've come away with a better understanding of brain abscesses, their causes, the symptoms, the treatment options.
Yeah, and maybe a new appreciation for just how complex and resilient the human brain is.
It's a remarkable organ.
It really is.
So, dear listener, what does this all mean for you? Well, if you're ever faced with a suspected brain abscess, either personally or in someone you care about, we hope this deep dive has given you the knowledge to ask the right questions, advocate for a thorough evaluation, and understand the treatment options that are available.
Yeah, I agree. I think the key takeaway here is that brain abscesses are serious, but they are treatable. And understanding how they happen, their signs and symptoms, and the treatment options available, it's incredibly valuable. The more you know, the better prepared you'll be to navigate this kind of challenging situation.
Absolutely. Knowledge is power, especially when it comes to our health. And it's a reminder that early detection and treatment are crucial. So if you experience any unusual or concerning symptoms, don't wait. Just go see your doctor.
Exactly. Don't wait for things to get worse. Early intervention can make a huge difference.
Well said. And on that note, we'll leave you to ponder the fascinating possibilities for the future of brain abscess diagnosis and treatment. Until next time, stay curious, stay informed, and most importantly, stay healthy.
And keep exploring.
Happy diving! It's funny, we started this whole deep dive talking about brain abscesses as something that most people wouldn't encounter very often. But the more we've talked about it, I've realized just how relevant this information really is for, everybody.
Yeah, I agree. It really shows how intricate and interconnected our bodies are.
Right. Like, who would have thought that something as simple as, like, a sinus infection could lead to a brain abscess? It just makes you realize you shouldn't ignore those seemingly minor infections.
Yeah. And it also, I think, underscores the importance of taking a holistic approach to healthcare, right? Considering not just the immediate symptoms, but the person's overall health, their environment, their habits, everything.
Right. It's like that butterfly effect.
Yeah, exactly.
A tiny change in one part of the system can have ripple effects throughout the body.
Absolutely. And speaking of ripple effects, thinking about those advancements we were discussing earlier, imagine the impact those could have, not just on brain abscesses, but on like the whole field of infectious diseases.
Oh, yeah. For sure. Rapid, accurate diagnostic tests like the ones we were talking about that could pinpoint the exact pathogen causing an infection. That would be huge for so many conditions.
Totally.
It would be a total game changer.
It would. And think about personalized medicine, being able to identify people at higher risk so we could either take preventative measures or intervene earlier.
It's really amazing to think about all the possibilities, and it really highlights, I think, why continued research and innovation in medicine is so important.
Absolutely. There's still so much we don't know. But the future of medicine is really exciting. We're on the cusp of some major breakthroughs that could transform healthcare as we know it.
Well, on that note of optimism and excitement, I think it's time to wrap up this deep dive. But before we go, I want to leave our listeners with a final thought. We've talked a lot about the science of brain abscesses, the causes, the symptoms, treatments. But there's also a human side to this condition that we can't forget. Just imagine, the fear and uncertainty faced by individuals and families dealing with this diagnosis.
Yeah, it's a good reminder that behind every medical case, there's a human story.
Exactly. And that's a powerful takeaway for everyone, I think. Whether you're ever personally affected by a brain abscess or not, it reminds us to approach healthcare and really all things with empathy and compassion, and to recognize that there's a human experience behind every diagnosis.
Beautifully said. And on that note, I think it's time to say goodbye to our listeners. It's been a pleasure to share this deep dive with you all.
Yes, thank you all so much for joining us. We hope you found this deep dive informative and maybe even a little bit inspiring. And as always, keep those brains sharp, stay curious, keep asking questions.
Keep exploring.
Until next time.